Hello, my name is Ryan, and I'm here today to talk to you about IV administration. As part of this technical presentation, I wanted to use something that not everybody's familiar with, but somebody could relate to. So I'm married to an RN. I watched her study and watched her practice IV therapy, and she's been practicing at the hospital as an RN for several years, and so I used her knowledge to help acquire something to discuss with you today. There are many different reasons that a person might need IV therapy. Intravenous devices are an important part of hospital care for the administration of fluids, nutrients, medication, and blood products. They're also a way to hemodynamically monitor unstable patients, according to Smith, 2012. IVs can cause anyone to be nervous, so hopefully I can talk about a few things that will help you as a patient, or maybe help you as a healthcare administrator get through this process more painlessly, a lot easier. The healthcare provider is going to need to know why you're getting the IV. They're going to need to know how long it's going to be in. They're going to need to know what size needle to use. Different size needles are known as gauges. The smaller the needle number, the smaller the gauge. A saline solution for rehydration is going to be a 22 gauge, which is rather small. This might be for somebody who's recovering from the flu. If somebody's going to have blood products administered, it's going to be a larger gauge, 16 or 18. This is going to help the red blood cells enter and exit the catheter without damage. The placement of the IV is important. The hand is the area that is the best for the risk of infection. It has the least risk of infection, according to Smith, 2012. But as many of us have probably experienced, you often get IVs in the inner part of your elbow, and this is known as the antecubital vein. It's pretty big, it's easy for them to find, but it's not necessarily the best place for them to administer it. It can kink, or it can pop out, and it's also hard to keep clean. The first step in administering an IV is to wash your hands as the healthcare provider. This is going to help reduce the risk of infection. The healthcare provider is then going to wear gloves, and at that point they're going to start feeling around to see where your vein might be. In this case, it's going to be in the hand, as I describe it to you, and so they're going to look, feel, see where they can find a vein. They're going to decide how much pressure they need to put on the vein to make sure that it's adequate for the needle to go into. They're going to apply a tourniquet on the forearm, and it's going to cause the vein to bulge. This will help them administer the needle and then leave the catheter in the vein. The next thing they're going to do as a healthcare provider is to use a chemical known as chlorhexidine or alcohol to clean the area where the needle will go in. This is going to kill bacteria, anything else that might be living on the skin. They're going to clean a downward motion toward the fingers. This serves two purposes. It cleans the area of infection, and it also stimulates some blood flow. It's going to engorge the vein. It's going to be punctured. The cleansing agent needs to stay on for 30 seconds, and this is going to ensure that anything that might be living on your skin is going to be dead. The healthcare provider is then going to pull your hand to tighten the skin to really kind of help the vein stay in place. Depending on how deep your veins are, and that's individual, determines the angle that they're going to use when they administer the needle. As you can see on slide 1, you can see the different needle gauges. I also have the different angles that a healthcare provider might use to administer the needle. If it's going to be intravenous therapy, it's going to be at a 25-degree angle. This makes sure that the needle doesn't go through the vein and it doesn't slide around once it's in the vein. Your healthcare provider is going to feel a popping sensation, and a flash of blood is going to be seen in the needle. At this point, they know that they've entered the vein and they can successfully insert the catheter. As you might know, or maybe you don't, it's not a needle that's left in your hand. It's actually a tube or a catheter. As you can see in slide 2, there's a catheter that's successfully in the vein. It's been through the skin and into the vein itself, and then it will be held in place. Once the needle's out, they'll run fluid through the IV, a saline solution, to see if there's any blood return. If they get that, that means that they've successfully administered the catheter into the blood vein. It hasn't gone through or gone into any muscle. The next step is the IV is secured to the skin using a see-through dressing, medically known as Technical.Woodward. This serves two purposes. It seals out any bacteria because of the cleaning agent, and it also secures the IV to the hand so there's not a lot of wiggle. It doesn't move or it's not going to be pulled out. This helps make sure that the IV can stay in for as long as it needs. There are different fluids that are considered IV medications. There are some drugs that are only able to be administered through IV. One is known as Humira, which is used to treat ulcerative colitis or arthritis pain. Saline is the only solution that can be run through an IV along with blood products, according to Lewis. And it needs an 18-gauge needle, like I said earlier, to keep the red blood cells intact. There are different solutions to help treat dehydration or malnutrition, and there are lots of other therapies that IVs are used for. Most of them have a prescription. Performing an IV correctly will also reduce several risks, but there still are some that come along even with a professional that knows how to do what they're doing very well. One of the risks is getting an IV is having someone have to poke you several times. This is not fun, it's painful, it's not enjoyable, but sometimes it happens. Another risk is infection. And this is something that you can help yourself by making sure that you're clean before you go in, or the healthcare provider, you can make sure that they're providing enough cleaning solution before they do the IV. Dehydration can cause issues. So if you're in control of when you're getting an IV, if you're not dehydrated from an illness or an accident, then make sure you're hydrated before you go to your healthcare provider to get an IV. Skin color, tattoos, and hair are some of the things that make administering IVs difficult. A person with a lot of practice and skill still might have a difficult time, but they're going to use their touch and sense of feeling rather than visual to get the IV into the vein. If the wrong size is used, it can rupture the vein. So it's really important that the healthcare provider understands how big the needle is, how big the vein is, and they match them up accordingly. The wrong angle can also cause several problems, so this is something that needs to be practiced thoroughly. If you ever see a healthcare provider not use gloves, understand that you are completely in the right to ask them to put gloves on before they continue the procedure. Just to kind of sum it up, IV catheters are very common, but doing them well isn't necessarily that common. So if there's a couple of techniques that a healthcare provider can practice, or a few things that we can do while we're getting an IV to help, we should. If you start to hold your breath when a healthcare provider is going to put the needle in your vein, it can actually constrict and make it more difficult for the healthcare provider to administer. So this is something that you need to make sure you don't do. IV therapy is common and reliable. Proper technique reduces the risk of infection. As you can see in my third slide, it shows IV therapy, an IV catheter that's secured and done correctly. It can be difficult, but with proper technique, there are many advantages. As you can see on slide 4, it can be a direct route to more accurately administer medication doses. Hopefully today you've learned something that will help not only you as a patient, but the healthcare provider provide comfortable, consistent care.